Hi, my name is Mary Ashley Allen.
And I'm Jessica McCurdy. We're students in the Auburn University's School of Nursing.
We would like to talk to you about a few key points we came across when studying cardiovascular issues in Vietnam veterans. There are many health issues that plague our veterans today, especially veterans who have been exposed to the herbicides in Agent Orange. There's a long list of diseases from Agent Orange, and I'm going to focus on type 2 diabetes and cardiovascular disease. These two diseases often occur in the same person at the same time. Type 2 diabetes occurs when the body does not produce enough insulin or the body becomes resistant to the effects of insulin. This results in hyperglycemia. Treatment and management are essential to improve the quality of life, and it could even prevent future diseases or complications. Type 2 diabetes can be seen everywhere, and this disease continues to affect more and more people every day. It is predicted that by 2050, 1 in 3 people will have type 2 diabetes. This shows you how widespread the epidemic has become. When first diagnosed with type 2 diabetes, lifestyle changes must be made. Glucose control should become a priority, and it can be managed with effective medication, proper diet, and exercise. There is a direct link between type 2 diabetes and cardiovascular disease, which indicates that proper treatment for diabetes is essential. There have been many studies performed to see what the effects of exercise and a healthy diet may do for diabetic patients, and all of the results point towards a decreased risk for cardiovascular disease. Patients with type 2 diabetes should make prevention of cardiovascular disease one of their main concerns when choosing their treatments. Diabetes can be easier managed than heart disease.
Another prevalent disease in all Americans is stroke. Last year, 795,000 people had a stroke, and of those, 130,000 died from it. That's 4 people dying every minute. And this risk is even higher for Vietnam veterans. Why? Because during the Vietnam War, veterans were exposed to a herbicide called Agent Orange. Agent Orange was sprayed on areas surrounding the troops, and troops were exposed to it in soil contact, drinking water, and bathing. Because of the high risk for veterans, it's important for them to take preventative measures for stroke and treatment of stroke. Prevention is very important for protecting veterans. Studies have shown that having other chronic diseases, such as multiple sclerosis, have an increased risk for stroke. By taking preventative measures for stroke, patients can lower their time in the hospital and lower their death rates. Rapid developments in the pharmaceutical field also have improved the decreased risk for stroke. 2 drugs that are very prevalent are warfarin and dabigatran. Warfarin has been around for a really long time, and dabigatran was just introduced in 2010. A recent study done shows that patients who took dabigatran experienced better quality of life, but were at an increased risk of bleeding compared to the patients who stayed on warfarin. By knowing more side effects of each drug and being able to compare the pros and cons of each, a patient is able to be confident that the drug prescribed is the best for the patient's individual needs. When a stroke is not able to be prevented, however, the next best action is the treatment of patient post-stroke to maximize quality of life. A recent study determined 5 trajectories a patient can be on after having a stroke. Each trajectory is associated with time recovering, services needed, and cost of care. A nurse's role in knowing the 5 trajectories possible and developing a care plan for each patient based on the appropriate trajectory is crucial for a successful recovery for the patient. Another important factor in treatment of post-stroke victims is the patient's outlook on life and the severity of the stroke experience. By seeking preventative measures early, the stroke is more likely to be less severe. Also, an improved outlook on life has been shown to decrease risk for stroke in a study done. Thank you all so much, and we hope you learned a lot. Have a great semester, War Eagle.